Signs of an upcoming heart attack and how to stop it. Have you ever experienced that feeling of tightness or pressure in your chest? Or maybe you've had shortness of breath, nausea, or dizziness. If so, you might be experiencing some of the warning signs of an upcoming heart attack. In this video, we're discussing a serious topic close to our hearts: heart attacks. But don't worry, we'll not bore you with medical jargon and scare tactics. Instead, we're going to have some fun while we educate you on the signs of an upcoming heart attack and what you can do to stop it. Now, I know what you're thinking. Heart attacks? That's no laughing matter. And you're right, they're not. But that doesn't mean we can't inject some humor into this topic and make it a little more lighthearted. After all, laughter is the best medicine, right? So grab a pen and paper, or your favorite note-taking app, and get ready to learn some valuable information about heart attacks. Let's get started. What is a heart attack? Now, for those who don't know what a heart attack is, let me break it down for you in layman's terms. Picture this. You're out for a jog, feeling good, feeling alive, and suddenly you feel like an elephant is sitting on your chest. You might also feel a shooting pain in your arm or jaw and break out in a cold sweat. This, my friends, is what a heart attack feels like. In technical terms, a heart attack occurs when the blood flow to part of the heart is blocked, usually by plaque buildup in the arteries. This can cause damage to the heart muscle, and if not treated quickly, can be fatal. But don't worry, it's not all doom and gloom. With the right knowledge and prevention strategies, you can reduce your risk of a heart attack and live a long, healthy life. Common signs of an upcoming heart attack. Now that we know what a heart attack is, let's discuss some common signs indicating an upcoming heart attack. These signs are important to recognize because they can help you get the medical attention you need before it's too late. Number 1. Chest pain or discomfort. First up, we have chest pain or discomfort. This is the most common symptom of a heart attack and is usually described as a feeling of pressure, tightness, or squeezing in the chest. Think of it as a bear hug that just won't let go. Number 2. Shortness of breath. Next, we have shortness of breath. This can be caused by fluid buildup in the lungs or decreased oxygen in the body. It's kind of like trying to breathe through a straw while running a marathon. Number 3. Nausea or vomiting. Moving on, we have nausea or vomiting. This symptom is more common in women than men and can often be mistaken for a stomach bug, but it's important to take it seriously if you're experiencing nausea or vomiting along with other symptoms on this list. 4. Pain or discomfort in the arm, back, neck, jaw, or stomach. Pain or discomfort in the arm, back, neck, jaw, or stomach is another sign of an upcoming heart attack. This type of pain can often be mistaken for a muscle strain or indigestion, but if other symptoms accompany it, it's best to err on the side of caution. Number 5. Cold sweat or lightheadedness. Finally, we have cold sweat or lightheadedness. A drop in blood pressure or decreased blood flow to the brain can cause this. It's like feeling like you're about to pass out on a roller coaster, but the ride never ends. Remember, if you're experiencing any of these symptoms, don't ignore them. It's better to be safe than sorry when it comes to heart matters. Risk factors for heart attack. Now that we've covered the signs of an upcoming heart attack, let's talk about some of the risk factors that can increase your chances of having one. These risk factors are important to understand because they can help you make lifestyle changes to reduce your heart attack risk. Age and gender. Let's face it, we can't avoid getting older. As we age, our risk of heart attack increases. Men are also more likely to have a heart attack than women, but that doesn't mean women are off the hook. Ladies, keep an eye on those risk factors and take care of your heart. Family history. Sometimes our genes just don't work in our favor. If you have a family history of heart disease or heart attacks, don't despair. Just be extra diligent about keeping an eye on those risk factors. And if you're feeling down about it, remember that genetics isn't everything. After all, Aunt Edna may have passed on her love of knitting to you, but that doesn't mean you have to inherit her heart problems too. Smoking and alcohol use. Now we all know that smoking and excessive drinking are bad for us, but did you know there are also risk factors for heart attacks? Smoking can damage your blood vessels and cause fatty buildup, while alcohol can lead to high blood pressure and irregular heart rhythms. So, maybe it's time to quit smoking and switch to a nice cup of tea instead of that fifth beer. High blood pressure. High blood pressure can sneak up and wreak havoc on your heart. But don't worry, keeping tabs on your blood pressure is easy peasy. Just get regular checkups and take steps to reduce your blood pressure if it's too high. Maybe try some meditation or yoga. Your heart and your mental health will thank you. High cholesterol levels. Cholesterol is like the bad guy in a cheesy action movie. It builds up in your arteries and blocks blood flow. But don't worry, you can be the hero in this story by keeping an eye on your cholesterol levels. Eating a healthy diet and exercising regularly can help keep those levels in check. And who knows, maybe you'll even feel like a superhero after a good workout. Diabetes. Diabetes, the arch nemesis of a healthy heart. People with diabetes are at a higher risk of heart attacks, but that doesn't mean it's game over. Keeping your blood sugar levels under control can help reduce your risk. So, time to stock up on some healthy snacks and check your blood sugar regularly. Obesity. Carrying extra weight can feel like a burden on your body, but it's not a life sentence. Losing weight and maintaining a healthy BMI can help reduce your risk of a heart attack. So why not try some fun ways to exercise, like dancing or hiking? You might just find a new hobby that you love. Remember, by making lifestyle changes and managing these risk factors, you can reduce your chances of a heart attack. So let's make heart health a priority and keep those tickers ticking like a champ. Prevention of heart attack. So, are you ready to defend your heart against those pesky attacks? Well, buckle up because we've got some tips and tricks to keep your heart in tip-top shape. And who knows, maybe you'll even impress your doctor with your newfound healthy habits. Number 1, lifestyle changes. First up, we've got lifestyle changes. Now I know what you're thinking. I have to eat kale and run marathons now. Not exactly, but a healthy diet, regular exercise, weight management, and stress reduction are all key players in preventing heart attacks. And hey, if you want to run a marathon, go for it. But if a leisurely walk and some yoga are more your style, that works too. Just find what works for you and stick to it. Number 2, medications. Next up, we've got medications. Sometimes lifestyle changes aren't enough to prevent a heart attack, and that's where medications come in. Now, I'm not suggesting you start popping pills like candy, but medications like aspirin, beta blockers, and cholesterol-lowering drugs can help reduce your heart attack risk. Just talk to your doctor about which medications are right for you. Number 3, surgical procedures. And finally, we've got surgical procedures. This might sound scary, but sometimes surgery is necessary to prevent a heart attack. Procedures like angioplasty and bypass surgery can help restore blood flow to the heart and prevent further damage. But of course, this is a last resort option and should only be considered if all other methods have failed. Now let's dive into emergency treatment to stop an upcoming heart attack. Emergency treatment for a heart attack. If you or someone you know is experiencing a heart attack, acting fast is important. Every second counts when it comes to emergency treatment, so let's dive into the steps you should take in case of a heart attack. Call for emergency medical assistance. First and foremost, call for emergency medical assistance. This should be your number 1 priority. Don't wait, don't hesitate, just call. Time is of the essence when it comes to a heart attack, and the sooner medical help arrives, the better the chances of survival. Administer aspirin. Next, if aspirin's available, administer it. Aspirin can help prevent blood clots from forming and reduce heart damage. But don't worry if aspirin isn't available or if the person's allergic. This step is optional and should only be done if it's safe. Cardiopulmonary resuscitation. CPR. If the person has stopped breathing or their heart has stopped beating, cardiopulmonary resuscitation, CPR, is the next step. This can help keep blood and oxygen flowing to vital organs until medical help arrives. If you don't know how to perform CPR, don't panic. Just follow the emergency operator's instructions on the phone. They can guide you through the process. Use of a defibrillator. And finally, if a defibrillator is available, use it. A defibrillator can shock the heart back into a regular rhythm, and every minute that goes by without defibrillation reduces the chances of survival. Most public places such as airports or shopping malls are equipped with defibrillators, so keep your eyes peeled and don't be afraid to use them if necessary. Remember, heart attack heroes, time is of the essence when it comes to emergency treatment, so stay calm, act fast, and don't hesitate to call for help. Well, that's it folks. We've ended our video on signs of an upcoming heart attack and how to stop it. If you made it this far, congratulations! You're one step closer to taking care of your ticker. Remember, heart attacks can be sneaky little buggers, but with the right knowledge, you can be prepared to give them the boot. So if you're feeling chest pain, shortness of breath, or sudden dizziness, don't just brush it off like a bad Tinder date. Take it seriously and call for help ASAP. And if you're wondering how to prevent a heart attack in the first place, well, it's simple really. Just eat a healthy diet, exercise regularly, and don't stress too much. In other words, don't be like me during tax season. On that note, I hope you found this video informative, and if you did, don't forget to hit that like button and subscribe for more heart-healthy content. Until next time, keep those hearts happy and healthy, folks.